Hello, I'm Sean Kennedy, the editor-in-chief of the American Journal of Nursing, or AJN as it's known. You're listening to a podcast in our Behind the Article series, which are interviews with authors of AJN articles. We also have a series called Conversations, in which we speak with nurses and others on hot topics in nursing and healthcare, and a series called Reflections, which are readings of our narrative columns on personal experiences in nursing or with healthcare. And you can find all of our podcasts on our website, ajnonline.com, under the Multimedia tab, as well as on iTunes and Google as AJN, American Journal of Nursing. Our content, including the article we will be shortly discussing, is accessible in print, online, on our website, ajnonline.com, or on the Institutional Ovid database, or our blog, AJN Off the Charts. You can find us on Facebook, Twitter, LinkedIn, and Instagram, and Pinterest. So today I'm very pleased to be speaking with Dr. Bernadette Capili, who is director of the Heilbronn's Family Center for Research Nursing at Rockefeller University, New York City. Candy, as she's known, is the author of one of the articles in our August issue, and this article is part of our series called Nursing Research Step by Step, which is coordinated by Candy and in conjunction with the Heilbronn Family Center for Research Nursing. Today, we'll be discussing her article, Selection and Implementation of Outcome Measurements. This is the fifth article in the series, and the series is designed to give nurses the knowledge and skills they need to participate in research step by step. Each column presents a concept that underpins evidence-based practice, from research design to data interpretation. All the articles are accompanied by a podcast offering more insight and some context from the author. And you can find the other articles and podcasts on the series in the collections tab on our website. So, Candy, it's so nice to be chatting with you once again. Welcome.
Oh, thanks, Sean. Thanks for having me. And thanks for giving me the opportunity to talk about the article.
Well, the series has been so well received, so I'm just again so thankful that you're leading this series with the Heilbronn Family Center. It's just been a great addition, I think, to AJN's step-by-step concept series. So in the prior column, we introduced the topic of measurement in nursing research, and that focus was on quantitative studies and statistical techniques that used to analyze numerical data. This column that you did continues this discussion of outcome measures, but focuses on questionnaire formats, which seem to be more widely used in nursing. So, can you give us a brief overview of why this column and what you include in the column?
Oh, sure. Thank you. So for this one, it kind of takes it from the fourth article, which talks about the different data kind of things. This one is actually selecting that instrument and how do you implement it, and how do you, I think the most important thing is trying to find the correct instrument or indirect measures, which is to us indirect is using the questionnaires or interviews versus a direct, which is inclusive of like maybe a blood pressure measurement or a blood draw or a biopsy that's more direct in terms of a data collection. So for this one, we'll talk about how to select the instrument, how to implement it, and how to go about actually having patients complete it, and even teaching your team how to make sure that everyone follows the same directions in completing an instrument.
Mm-hmm. So in reviewing reports using questionnaires as a consumer, say, of nursing research, and I'm a nurse reading a report and it's talking about a questionnaire, what are some of the things that I should be looking for as a reader that would tell me, was this study done well? Was the questionnaire the right one? Was it valid? Are there quality indicators that as a reader I should be looking for?
Yeah, sure. One of the things, first of all, is want to make sure that the instrument, let's say if it's insomnia, actually the questions actually reflect insomnia questions. Or if it's quality of life, like the SF-36 is one of the most famous ones, actually does indeed measure that. Often too, the paper should talk about the psychometric properties of an instrument, so psychometric properties talk about has it been tested? Is the measure reliable and valid? Valid being that does it actually measure the concept of insomnia, the concept of maybe depression? Also, then the reliable also thinks about reliability is a statistical kind of thing to making sure that the questions, if there are similar questions in the instrument, that there's a correlation between them. And also, you want to make sure that there's also that different people, or can actually use that instrument and get similar results. So there's an inter-rater reliability kind of thing that you look for. I think the other piece though is also there's the Cronbach's alpha, which the Article 4 talks about. So that's one of the big things people look at. You want to make sure maybe it's like 0.8, 80 or above, which means that's a good sign for the inter-rater, the reliability kind of concept. But the other piece I think is really important is the population. So sometimes the authors of a paper, or the people, once they finish a study, they publish the paper, we'll talk about, well, this instrument has been used in blah, blah, blah population. So you want to kind of make sure also the instrument has been used in a similar population, also the language, because I think one of the things that's important is, let's say you take an instrument and you're taking it to another country, let's say China. And sometimes concepts here in America, in the States, may not actually translate directly into like an Asian culture in China. So it's not just about getting a professional, someone who will transcribe or translate. It does not necessarily. That's not actually just all you should do. You should actually try to find an instrument. If you're trying to find it that's already been used in the Chinese population, that was actually validated in that population. If it's an elderly, make sure it was actually an instrument that's actually used for people who are older, or maybe for adolescents, or children from 6 to 12 or whatnot. I think that's also an important indicator that you want to look at. I'm trying to think of some other good pointers to consider. The other piece too would be nice. Sometimes there's no room in journals to actually post the actual instrument. I think it's also important, hopefully, that when they write the paper up, they kind of tell you a little bit about the instrument. How many questions there were. How often did they give it to the participants, and was it actually how was it administered? I think it's also kind of an important thing to think about.
Well, I like the fact that you emphasize population. In many of the papers that we get, I shouldn't say many, but in enough that it certainly strikes a chord with me, we get people who will use an instrument, and we realize, for example, it's on elderly assessment, but perhaps they're talking about community dwelling elders, but yet the assessment was done, a questionnaire was developed for people in the hospital, or vice versa. And so we see sometimes the population of the original questionnaire doesn't fit the population that they're now studying, and so that's a problem. And I think that might be a common problem that people don't think about. I'm not sure.
Yeah, I think sometimes, because it does take time to actually retest it. So I mean, it's not like you can't use it, but I don't think I would use it for an actual clinical study until you've actually done another test, just in that population. But I think as part of it is maybe a cost factor, a time factor, So they try maybe some people think, oh, maybe it's okay, but
Well, the other thing we get too is people develop their own questionnaire. They say, we developed a questionnaire in our hospital and then they try and report that as, here's a valid, quite reliable questionnaire, but it's something that, a few nurses made up the questions and then gave them out to the patients or tested them with patients. But there wasn't really a look at validating the population or the tool itself with either other patients or even outside people looking at, looking at what they were doing, evaluating. So it's I think that's a great idea. People think sometimes I think people think, oh, it's easy. We'll just do a quick questionnaire, what they call down and dirty, research.
Yeah, but it's like kind of like there's a whole space validity. Make sure that you take a look. Is it even clear? Besides, I mean, that's just the initial. And there's just a whole host of. I don't develop instruments, but I know that it can be a long process.
Yeah.
To get it to the whole psychometric properties you're looking for, so that it can be more usable to a lot of other, for a lot of groups. Yeah.
Yep. That and I think this is such an important topic, the two measurement focus columns, because uh, if you're not measuring with the right tool, then it just invalidates really everything that you're looking at.
Yeah, and I think one thing that's important too is you want to make sure that measurements, whatever you're measuring, is actually what you want the outcome to be. For example, if you're looking, oh, so this is the other piece of quality indicator too that I think I should address as well. So if it's, even though we in the article we briefly address direct like such as like the blood pressure or pedometer. So one of the first things too, the quality indicator that you look for in a paper too is like how do the investigators or the authors address making sure that there's consistency and making sure the equipment was calibrated. I
Hmm.
think that's another important piece. Like, how did you teach the staff or your coordinators to measure the blood pressure or measure the height and weight? Did you, for blood pressure, for my personal study, I make sure that it's an instruction that, rest 5 minutes before you take the blood pressure. And
Hmm.
we actually have a whole, instruction on how to do that and how to calibrate the equipment. I think that's important. And the other piece of quality indicator in terms of even indirect measurements, such as, your paper and pencil, is again instructions on the staff or the folks, the coordinators who are administering it to participants, making sure that it was correctly done. Or if it's an interview, again, that's another form of getting your outcome is, how were the questions administered? How was it by phone or was it by, like now it's Zoom? And how were the questions actually spoken? And if so, was there, how did you allow the participant maybe to clarify a question or how to probe the question? That too has to be clear.
Yeah.
Because otherwise it's your outcome. Yeah, it's your outcome. So then again, if you can't measure the outcome correctly to collect, collecting that data, essentially it's your outcome, it needs to be consistent across all your, whether it's from participant 1 that you collected to 250, it needs to be, consistent.
Standardized for everybody. Yeah.
Yeah.
As somebody who's certainly done a lot of research and overseas research, what suggestions would you have for beginning researchers in deciding on a format? If somebody, and I know it certainly depends on what they're looking to study, but
Mhm.
for example, if they're using something as we were talking about in terms of qualitative, what's the most important thing in terms of deciding on what type of format?
Oh, instrument. Oh, sure. And like instrument, I think first of all, one of the things is so if you're going to look whether if there's an instrument that matches your study, like let's say insomnia or quality of life, I would go with a paper and pencil that's been out there that has good psychometric properties. Read the literature. This is how I learned. I mean, I read the literature. I saw what was out there. And the other piece is to also pilot test it. It's so important. One of the things that we always do in our studies is we get what we call our patient consultant. So I work in HIV, I do HIV work. We have patients actually review the instruments to make sure they can understand it and make sure like, is this feasible? Is this way too long? They'll say, oh my gosh, this is way too long. Oh no, this is way too small. I can't see this. We have some of our patients are getting older or like we give diaries and they tell us, can you make it smaller so we can put it in our backpack or whatever? We can bring it around with us. If it's too big, it's cumbersome. We can't fill it out for you. So those are kind of the things I think it's pilot testing, again, looking at the literature. Again, if there is something that's already out there that's been validated, I would say go for it. In terms of a qualitative interview kind of thing, sometimes for that one, I think you do need to develop your questions. Sometimes, in focus groups, I've done this as well for focus groups, and you have to, set out your questions. But again, you need to practice and make sure those questions
Mhm.
are clear.
Mhm.
And when you do that, making sure I would have it recorded, and then again, when you're in terms of quality control, if you have multiple folks that are going to be interviewing participants, do spot checks on those recordings, making sure that they're actually uh, speaking to the patients or administering the questions or saying the questions as they were trained to do. Again, just spot checks, and this way you can do a little correction and kind of, have a method of saying how often you will be doing that. Whether is it like every 2 weeks you'll be like randomly selecting 2 or 3 interviews and just kind of spot checking and doing the training that way. I think
So
that
that's
would be something important. And also speak to your mentors. Obviously, speak to mentors. Speak to if you're at a hospital, speak to people who you know are maybe doing that research, or definitely if you're at a university, I'm sure there are probably people who are doing research. Let's say if you're doing something in aging or maybe HIV, shoot them an email, reach out to them and ask for some guidance.
hmm hmm all good suggestions. And uh, to me, the takeaway is consistency and use the resources that are already available, whether it's uh, a tool or people that are already familiar with this type of work. So
Hmm.
save yourself a lot of heartache, I guess, in going
Yeah,
down the wrong
yeah,
path.
exactly.
Well, Candy,
Exactly. And
as
I always think
always,
of doctoral students. Yeah, yeah.
go
Sorry,
ahead.
go ahead.
No, go
I
ahead.
always think of the doctoral students who are getting the PhD. I know they probably struggle also with making sure they have the right instrument because their dissertation chairs will probably say, you make sure that it's the validating tools for the population. you
Well, Candy, as always, it's great talking with you about the research and the column, and I look forward to more chats.
thank you, Sean.
Take care.
You too.